So at this time, I'd like to introduce our speakers for today. Let me go ahead and make sure they'll be able to share their screen. But Dr. Rachel Holliday and Dr. Lindsay Moore-Ostby, who are the founders of Indy Direct Docs, and they're going to share more with us about how they've built their practice and direct primary care. So doctors, you have the floor.
All right, let's see. So I'm unmuted. You can hear me, right?
Yes.
Okay. And then that one.
Yep.
Okay.
There you go.
All right. Well, we are Indy Direct Docs, and we do a form of healthcare called direct primary care, which we will get into in this presentation. And we do believe that it is a cure for our broken medical system. So hopefully you find this intro to be interesting and want to listen more. So who are Indy Direct Docs? Indy Direct Docs is two doctors. I'm Dr. Rachel Holliday.
And I'm Dr. Lindsay Moore-Ostby.
And we are both board certified in internal medicine and pediatrics. So that means we take care of both children and adults. We are generalists. And for the last several years, we've been doing primary care in an insurance-based system. However, in August of 2020, in the middle of a global pandemic,
Yes.
we decided to become small business owners and open up our own direct primary care practice. And it has been awesome. Why has it been awesome? Because direct primary care is awesome. Direct primary care, sometimes known as DPC, is a model of healthcare in which a doctor does not bill insurance, but instead is paid by a patient by a flat rate monthly membership fee. So why would you do that? You're wondering. You would do that because in our insurance-based system, insurance actually dictates when a doctor does and does not get paid. So it kind of limits a doctor's ability to do a lot of different things. And so one thing that it does is prior to COVID, the only way that a doctor got paid is if a patient actually physically came in the office, physically sat in front of a doctor in an office, and then a doctor submitted certain codes. However, we are not limited by insurance anymore. And so when a patient accesses us, calls us, they talk to us on the phone, and they can access us through either extended in-person visits, phone calls, texting, and emails.
We've both already quickly texted with our patients today, and I just had a patient call, 2 minutes, got me on the phone, had them scheduled for a 3 o'clock visit today. It's that simple.
It's really cool. So, question we get pretty often: why won't you take my insurance? My insurance is very good, and likely that's true. And we'll kind of get into why we personally don't bill insurance, but we think it might be a good idea for you to have insurance. So, luckily, when a lot of people think of doctors, they think of the Norman Rockwell version of doctors, just very smart, very dependable, very caring, spends time with patients. And that really is why both Lindsay and I got into medicine. That's the type of doctor that we wanted to be. That's the type of doctor that we trained to be and that we really tried to be in the insurance-based system. However, we ended up turning into this doctor. So there is a website called Doximity that has articles written by different doctors. And I read an article about 2 years ago when we were first learning about direct primary care that said that when we use the computers as doctors and we're so busy that we're only kind of halfway listening to patients sometimes because we're constantly putting in codes and orders, that it's similar to texting while driving.
So true.
And when I had that realization, it was so shocking to me. And I felt so bad about that because I would never text while driving. Because even though I'm a very good driver, if you're not fully paying attention to something that is so serious, you can miss things and really dangerous things can happen. And after that, I started to kind of monitor myself differently as a doctor. And I thought, I've got to do something different.
Yep.
So, the other thing that that I would like to kind of draw attention to is just the difference in ideology of the insurance-based system versus direct primary care. So I would say that the insurance-based system is a type of transactional healthcare where patients, you don't see them very often. You might see them once a year, and even though you want to be that Norman Rockwell doctor where you're totally present in front of them, you do remember, their their daughter's name and that their daughter has been going through cancer treatment or just different things. You also have to think about getting paid yourself. And so as the patient is talking, you're kind of thinking, how can I translate this human being into a code so that way I can get paid, keep my lights on, and pay my nurse.
And the 8 other staff that are behind the scenes fighting insurance to get paid at all.
Right. And then again, most of the time patients can only receive care when they're actually coming into the office. And that's not always the best thing for the patient because they might have to take a half a day off work just to get a refill on their allergy medicine, when really they could just text you if there was another system that was available to them and you could send in that prescription for them. I'll get into this in the next slide, but in the insurance-based system, there's codes for every diagnosis. And so a doctor is trying to remember the exact code for a particular diagnosis and put it in the computer as they're talking with you and diagnosing you. And they're also thinking about how to put certain wording in their note so that way they can get reimbursed by an insurance company. Because if you don't put in the right code or you don't grammatically put exactly what an insurance company wants, they just won't pay you.
And they change their mind all the time. Yep.
So because you're, as a doctor, worried about, am I going to get paid? And you also are worried about, are patients going to show up or not? Because 20% of the time, patients don't show up on a given day. And I don't blame them, because if all they wanted was a refill on their allergy medicine and something better came up in their life to do, and they just don't show up, and then they call you again to try to see if you'll just send it in, who would blame them? But because of that, doctors will frequently double book themselves. So they'll have 2 patients at 3:15, thinking that one patient might not show up. And if they both show up, then they're just running around like crazy.
Yep.
So
that's why you end up waiting an hour plus in the waiting room, because the doctor is desperately trying to get people seen and actually spend maybe a few extra minutes in the room. That's the other thing about transactional healthcare that I always remember. You had your aha moment with like the electronic records and the texting. For me, one of my aha moments was when I realized that I was thinking about the patient as demanding extra time from me. And all of a sudden it hit me like, wait a second, they're not asking for extra time. They're asking for what I want to give them, which is the time that every patient deserves to have with me to really feel like I heard them. That's what I wanted to do, but it was turning the patient almost into like the enemy, which is the opposite of what I want. That was my aha moment, which that reminds me of.
Yeah. So I just wanted to share about these codes.
They are this ridiculous.
Yeah, they are this ridiculous. So these are 2 of our favorite codes. One is burn due to water skis on fire initial encounter. Yes, in fact, there's also a code for burn due to water skis on fire subsequent encounter.
Burn due to being sucked into a jet engine subsequent encounter.
Yes. And bitten by a turtle. I've never diagnosed anyone with that, but I do know how to find the code for it. However, I've diagnosed many patients with diabetes, and I can never, ever, ever find the code for diabetes. No, like
there's at least 50 codes for diabetes, and you have to find the right one.
Yeah, and you have to find the exact right one.
That's why I'm often like, when the patient, I would be like, hold on, nope, no more, hold on. I've got to find the code, or I can't submit this to your insurance.
Get paid.
I have to find the code, then we'll talk. Hold on. Very frustrating.
Yeah. Anyways.
So that makes us like, the things that you hate about your doctor's office, all of this stuff, the behind the scenes, never getting hold of your doctor, never getting someone on the phone who knows you, waiting hours to get back this garbled message that didn't even answer your question. All of those things that you probably hate about your doctor's office, the doctor hates too. That's the like hidden secret. The doctor hates it too. And most doctors are employees. Even if they're independent doctors, they're employees essentially of an insurance company. Even if they're the boss at the office, they're not really in charge. And so they have no control over any of it. They can't fix it. They probably have tried. And they're probably banging their heads against a wall and just not telling you. That's like the ultimate secret.
Yeah.
That we then finally decided to make public.
Yeah. All right. So now we don't do transactional healthcare anymore. We do relational healthcare. And that's what direct primary care has allowed us to do. So direct primary care is based on an ongoing relationship with the same doctor, your doctor. The way that we accomplish that is being paid by a monthly membership fee. It is the same fee every month, regardless of how many times you access us. You can know upfront how to budget us. We can know upfront how much money we're going to make, so that way we know how big of a patient panel we need to have. And there's no copays or, in general, additional fees. We'll get into the times that you might be charged a little bit extra, but for access to us and our knowledge and our care for you, it is the same fee from month to month. Like I was saying earlier, that also opens up the availability of how you communicate with your doctor. And you can also communicate with us after hours and on weekends. We kind of talk to our patients, and we let them know that for urgent and emergent things, rather than going to urgent care, they absolutely should contact us over the weekend. But for things that can wait, like if you need a medication refill, that would be a time that you would send us an email and we would check that on Monday. So it's a relationship. We're always giving each other feedback about the best way that we can have this relationship and have both of our needs getting met. And because we have opened up this communication and this access, our patients don't hoard their problems, and they don't wait for a time that they can finally get a day off work and then bring us 10 problems, but we're constantly in communication with one another. And we can also focus on wellness care, because we don't have only 7 minutes to give them. We can schedule them for an hour, focus on all of their acute needs, and then move on to the fact that, what can we do for your diet? You know, you're not sleeping, you're having issues with your spouse, and all of those things affect your health. It's all healthcare. It's all related. So that is relational healthcare.
Yeah, just this last weekend, I had a patient who we knew she'd had COVID recently, and she sent me a quick text message on the weekend and said, "Hey, I'm feeling short of breath. I don't know if I should go to the hospital." And I said, "Hold on, let me get on the phone with you. 5 minutes. My family wasn't even bothered that I stepped out of the room for a couple minutes, and I was able to very quickly figure out, you don't need to go to the hospital. This is when I would say that is different. Here's what you do today. Get me a visit, come in to see me literally Monday at 8 a.m. And we kept her out of the urgent care. We kept her out of the hospital. Honestly, she saved her entire year's membership, was paid for by not going to an urgent care, essentially, which is, I don't know, fun for me, very fun for her. So it worked out nicely. It's really fun to be able to have that relationship.
Yeah. Okay. So what is covered by this monthly fee? So primary care is covered by this monthly fee. What is primary care?
More than
because unfortunately, in the current system, when you're expected to literally do everything in 7 minutes, primary care has been just dwindled down to a referral machine. And that is not what primary care should be. So what we do as primary care doctors is we do preventive medicine. So that means that we try to catch things like elevated blood pressure, elevated sugars early, and try to see what we can do with lifestyle changes to prevent those from progressing on into high blood pressure and diabetes. It also means that we make sure that you're getting all of your cancer screenings on time, and try to catch potential cancers early. Also would mean that we would make sure that you're up to date on your vaccines. We also do chronic care management. So unfortunately, sometimes just because of your genetics, you are going to end up having things like diabetes and high blood pressure. But with regular and routine access to us, we can control that a lot more easily and better with that open communication with us, and actually take the time for you to understand, why am I taking this pill? What does this pill actually do for me? And maybe you don't like that pill, and maybe there's 3 other pills that we could give you if we only knew that you hated that pill and what you hated about it, because we have the time to actually talk to you.
True. A lot less referrals when it's something I could do. I used to have to refer to people just because I can't handle that much in a 7-minute visit. Now I can actually really practice at the top of what I'm able to do and save the referrals for the complex issues.
Yep. Urgent care. So unfortunately, in the insurance-based system, because you're constantly double booking yourself because you're just trying to make sure that you can make enough money, you get a cold, you call in, you're probably not going to see your doctor that day.
Not unless you called them at 8:01 and kept calling and got really lucky.
Maybe you might see another provider at that clinic.
If you're lucky.
Hard to say who you'll see. Or otherwise, you just stay at home, see if you just get better by yourself, or if you get really sick and then you end up in an urgent care or an ER. But because we get paid whether or not our patients see us, and they do see us, But we have a much more open schedules to where we can do video visits. We can have patients actually come in and see us and help keep them out of urgent care and ER and feeling a lot healthier. And then the last thing that I'll say that we do is we do coordination of care. So maybe you do have to see specialists, but you are an organ system. You are not just one organ. So even if the only specialist that you have to see is a kidney specialist, we still getting their records and talking to your kidney doctor, kind of put in what your kidney problem is in relation to the rest of your body. Let's say you have to see multiple specialists. We as the generalists looking at you as a whole system, make sure that what your cardiologist is doing and what your kidney doctor is doing is coordinating and making sense together. And then for the times that you do have to go to the ER or the hospital, we can call ahead. You can have us on the phone when you're talking to the ER doctor, and we can help translate things for you and make sure that you don't forget anything. And then if you have to get admitted to the hospital, we can talk to the doctor in the hospital too, and then get you in pretty quickly back to see us once you get discharged from the hospital. So there really is a lot of things that we can do as a primary care physician.
Absolutely.
Thinking a little bit more concretely, things that are covered by the monthly fee are all of the in-person and virtual visits, emailing, texting us. Also, multiple in-house tests are pretty cheap for us to run. And so since they cost us less than $1, we don't charge you extra for it. So things would be like a urine test, a pregnancy test, testing you for strep throat, testing to see if you have a yeast infection, if you're a woman, checking your blood sugar, if you're a baby, checking to see if you're jaundice, and then checking to see if you're anemic. That is an in-house test that we can do. And then there are certain small procedures that only our time is the thing that is costly for it. And so if we're able to do it within a certain amount of time, we don't charge you extra for that. So things like that would be stitches, running an EKG, because we have an EKG machine and it just costs us less than $1 to print that piece of paper.
How much did I get charged last year for my EKG?
Dr. Moore, that was 2 years ago.
2 years ago now.
Had an EKG while in office, and we won't get into that story, but she had to have one in the middle of the day while working. And I read it, and then we said, well, we should document this in the insurance-based system. And she got charged with her private health insurance, high deductible, her own office, $200. So just to give you some perspective.
Zero at our office.
Draining an abscess, we don't charge extra for that. Things like a skin biopsy or doing a pap smear. There is another doctor called a pathologist who does have to look at that underneath a microscope. And so you would pay for the cost of that doctor's reading of that, not for us to do that procedure. And that would be less than $50 to do that
with our discounts.
Yep. Okay. So, kind of thinking about it another way, once again, it's just the monthly fee, regardless of how many times you access us. And so a good way to think of it is that we're like Netflix for your doctor, because some months you might need to binge on your healthcare, and other months you might not really use it at all, but you're paying for that access and that ability and being able to budget it up front to know exactly how much something is going to cost you.
Exactly.
Other perks of being a patient of a direct primary care practice, we have access to wholesale labs. So we can do something called client billing. So first of all, think of us as an out-of-network doctor. So if you have health insurance and you want to use your health insurance for anything other than our membership, we're happy to bill it. If you want to use it for your labs, we're happy to do that. If you want to use that for your medicines, we're happy to do that. And like literally everything, we're happy to do that. But we just find that there are times, especially if you have a high deductible insurance plan, that it actually would just be cheaper for you to pay cash for something, because day-to-day things in medicine actually are not expensive. You just think they're expensive because you pay so much in premiums for your insurance, and because the cost of the day-to-day things are hidden. It's only hospital care that is in general the really expensive part of healthcare. And so if you can have very good primary care, the hope would be that your healthcare is not expensive. Okay.
If you're not making a fake cost by an insurance hospital system
Yes.
to make you get a discount, which is still 10 times more than what you should be paying
Right,
for it.
right.
That's the trick.
Right. So back to wholesale labs. Okay. So in the event that you don't want to bill your insurance, what you can do is our practice will pay for your labs, and they'll get drawn at a LabCorp facility, and then you can we'll just tack that onto your bill for us for the next month, and you would pay us. And because you pay us, and LabCorp doesn't have to worry about chasing you down
Or your
or
insurance.
chasing down the insurance company to
get
say,
the right
please pay me.
code.
They give us a significant discount.
Yeah.
So to put this in perspective, your yearly blood work that you would get, where you would get tested for diabetes, see what your cholesterol levels are, and check and see how your liver, kidneys, and electrolytes are. Those 3 labs together plus a lab draw fee from LabCorp is $15.
I spent almost 200 getting the same stuff drawn, actually not doing discount, like client billing, not too long ago. So
yeah,
I know what a discount that is.
Yeah. We also know the cheapest place in the city to get like a chest x-ray or just different x-rays. And you can get one pretty close to us for $50. And then we also know of the cheapest places in the city to get like CT scans and MRIs. We know of several places in the city, you can get a CT scan for about $500. And then as far as medications are concerned, we do try to use independent pharmacies as much as possible, just because we do find that they're cheaper, and we have ways to figure out how much medicines are going to be and which particular pharmacy for the medicines that you are on would be cheapest for you. And then there are times that we have access to wholesale medications, and it could be that it's cheaper for us just to purchase your medications. It just depends, because every medication is a little bit different, and there are some pharmacies that run pretty good deals on medicines. And so, yeah, that's just a thing that we try to coordinate for our patients.
We have time to do that, which is totally different.
We have time to do that.
Like basically what I say we specialize in at this point is adding as much value and as much cost savings as we can for our patients. And it's different for each patient, but we are always networking and looking for more transparent options, discounted prices, anything that we can do to help you know what you're getting into and save money. If there's a piece of equipment that we can save up for and buy for our practice and not make you go elsewhere, we do that whenever we can. And that's the fun part of it, I think.
Yep. Okay. So a couple of other ways to think of DPC, because we have so many different metaphors for it. One is called blue collar concierge. So obviously we're providing a higher level of care than your typical practice. So it is in a way a concierge type practice,
Fancy doctors.
But it still is affordable. So our fees, for example, for the first member of a family, it's $95 a month. If you're an individual and you're the only one who signs up, it's $95 a month for you. If someone else in your household who you do life with and live under the same roof also signs up to be our patient, it's $75 a month for them. And then if you have a third, fourth, or fifth family member who lives under the same roof, does life with you, signs up to be our patient, it's $35 a month for them. So for a typical family of 4, it's $60 a month per patient to be our patient. And then the last way to think of direct primary care is just that we don't use our health insurance like actual insurance. Insurance means in case of emergency. Insurance means I hope I never have to use this. For our car insurance, we hope we never get in a car accident and have to use it, right? And so instead, for the day-to-day things like putting gas in my car, I don't check with Geico before I put gas in my car. I just do it. I just know that I like the gas station that's right by my house, even though it's a little bit more expensive. It's convenient for me, and that's where I go, and that's my choice, and I can budget for it, and that's fine. And so we just think that it would be better if that's how we were able to use our health insurance, because again, for day-to-day things, it really is not that expensive, and you can get a higher quality of things if you just know how to budget for it.
Absolutely.
So
yeah, insurance used as insurance. It's a very strange idea.
Novel.
But the other thing about that is that car insurance prices, they can stay lower,
right,
and they can be competitive with each other, and they can keep trying to get cheaper rates, et cetera, because they're not being used for your gas, for your oil change, for your new battery. if you started having to do that with your car insurance, you would have to be submitting paperwork every week or month for which gas station you got to go to this month, or if you wanted to go to the one next to you and not the one down the road where they got, a little bit cheaper price that month, and it would change next month, more paperwork, you'd have to have codes. It would all get very crazy and high admin, lots of bureaucracy. And that is where all the crazy price inflation and all of the complexity and all of the not getting to know the prices, that's where that all comes in. That's why your doctor, if you ask most doctors, how much will it cost me to get that test you're ordering? They aren't trying to hide this from you. The doctor has no way of knowing. No way of knowing. They don't know what's fair. They don't know what your insurance will agree to. They don't know. I didn't know. Now I know. But it's just insurance is not being used as insurance is ever intended. It's being used as something we have to use for everything. So if we could uncouple primary care from all the other stuff you hope you don't need, or maybe you have this really crazy disease process and you do need chemotherapy, or you do need a surgery, you do need the hospital, all sorts of things. If we broke those two apart and we used insurance for the stuff it's truly needed for, and we had an option like primary care done the style we're talking about, you could save money by putting those two pieces together again the right way. We're getting there. DPC is threatening the big people enough that they're trying to copy it. They're trying to fight against it in federal levels and things like that. So we have their attention. It's exploding. It's booming across the country. It's booming in Indianapolis. We know doctors who are jumping into this system frequently now. It is happening. We've become enough of a threat to disrupt the system. And we know that because they're paying attention to us and they're not liking us. So we're getting there. It's going to take some time and continued efforts to make this more of a reality for as many people as we can, because long-term, we really do know how much money you can save this way if we just start thinking about insurance not as everything. If we start breaking it apart, it's a very different way of considering it than we're used to, and that we were used to. This took us a while to wrap our brains around. We really thought that this might be a scam. It sounded like, no way, nope, that can't work. But it turns out it does. And now we believe so strongly in this model. We're not here just trying to pitch everybody to be our patient. We know and can speak mostly to what our practice looks like. And of course, we'd like to get patients, but we believe so strongly in this model that I'm a patient of a direct care practice, not ours. My parents are a patient of an office much closer to them on the north side. Rachel's got her parents, now signing up for DPC practices as well. We truly believe and see the value in this model. So we want to go out and educate about the model. We honestly find that we don't really have to sell it to people.
Yeah.
We just have to tell you about it.
Yeah. And so I think this is just a good transition.
Yep.
So there's our phone number and our email address, and we're the ones who answer our phones, and we're the ones who answer the info@indydirectdocs.com email. And so if you know of anyone who would be interested in this model or just have questions, we do free meet and greets all the time.
Yep.
We don't do a PowerPoint like you all got today, so you're welcome. You got
you're special.
You're special, yeah. But just like Lindsay is saying, we think that this model of healthcare would benefit so many people that we welcome people contacting us, because we want to see if our practice is right for them, or if perhaps another direct primary care practice that's in the city is right for them.
I've recommended others that I thought were the right doctor for a patient on the phone with me. And I've said, I'm kind of talking you out of me, but this person I actually think is right for you. We want you to get the right doctor for you. And if it's not me, that's okay.
Yeah. And if you at this time don't feel like you could or want to be our patient, another way that you could support us is just liking us on Facebook and following us on Instagram. We do try to periodically post things on there that are either about just general health or the healthcare system, for it to be both, educational and entertaining at times. And we also have a blog at our website, indydirectdocs.com.
Yeah.
So
anytime we can just get connected or get the information out to the public as a whole, we're helping people get options for their healthcare. And that's what we really want it to be about. Insurance is not healthcare. It is insurance. And we want people to know the choices that are out there. And we're not going into it much today, but there are also a lot of options out there with DPC practices. They do very well with partnerships with businesses, whether it's just you want to have the healthcare, or whether you're a small company under 50 that can't afford to provide health insurance for your employees, and you don't have to, or maybe the insurance that you are providing because you want to is just super expensive, and maybe your employees, like some we've talked to lately, are choosing not to even get the insurance you offer because they can't afford it. Direct primary care can offer an actual health care option for your employees. It can really help to retain employees. It can help. We even offer discounts for employers. Some practices do, they're all different. And if you happen to have more than 50 employees and you are looking at a self-funded plan where you are taking on more of the risk, but also taking on more of the savings and money, we find that partnering that with a DPC practice membership that you help subsidize actually helps your employees be happier, healthier, miss less work. And because they see a doctor who doesn't submit anything to your insurance that you're self-funding, your insurance premiums don't go up when your employees use us. So there are a lot of options out there for businesses as well as individuals, which again, we find really exciting because we get to know people.
Yeah. So final slide. Anyone have any questions for us? Yes.
I have two questions.
Uh-huh.
The first one is, I assume you are on the south side of Indianapolis. Is that correct?
No, so we are actually located at 22nd and Meridian.
Okay.
So we are just north of downtown. We're about 50 feet from a red line bus stop out front. We have free parking in the back. We have found though that because we're very close to the highways and we're a straight shot at Meridian to the north side, we have found that quite a lot of patients see us who are in the suburbs, and they find that we're still more accessible and faster. They can actually get down for a visit with us. There's no waiting room time. We spend 30 minutes with them. They often are still home before they would have been from their usual doctor, and they actually got 50 times as much time with us and no waiting room time. Plus, we do a lot of that virtual care when it's appropriate. And so we find that you cut down on the number of visits you're required to make. So we find that we're really kind of been surprised. We're getting people from all over around Indy, which was a bit of a surprise for us.
Okay. Actually, it's going to probably turn into three questions. Second question is, what would be the best way to find a direct primary care facility close to where I live?
Good question.
How would one do a search?
Hang on. Where do you live?
Yeah.
We might know.
Noblesville.
Noblesville.
Yep.
Oh, okay. There are a couple in Noblesville.
Mhm.
So there's a website called dpcfrontier.com. And it was created by a DPC doctor who, totally interesting. His parents were doctors. And so he's like, I should know about the legal side of things. So he went to law school and then went to medical school because he's like, I'm going to know the legal side of things. And the DPC Frontier is all about like the legal things that have to do with direct primary care. But he also created this thing called the Mapper.
And it's on his homepage. So if you
Yes,
go to the
you'll see
website,
it.
you'll be right at it.
Right. And it shows you where every direct primary care practice in the country is.
Mhm.
So you can zoom in and see the ones that are closest to you in Noblesville. There are like 3 in Noblesville, I believe.
And others that are very close to it. So you can sit there and you can link straight to those offices, usually from the website. So you can compare what kind of provider is it? What do they offer? Do they have a specialty in anything? What are their prices? How do I get hold of them? So yeah, that's how I found my parents' doctor. It's how I found my doctor. It's how I met all the DPC doctors that we know around Indianapolis, because I found this Mapper thing. And that's where we started from.
Yep.
Okay. My final question is, the monthly fee, is that set up on a time frame, or can it be month to month, or is it 6 months or 1 year? Is it a long-term agreement?
It's going to depend on the office that you go to. We currently do not have any sort of a contract that says our patients have to stay with us for a certain amount of time, because we feel strongly that if it turns out the relationship is not what you hoped for, we don't want you to feel like you're obligated to keep seeing us. So patients can cancel with us with like a 30-day notice. We charge our patients typically on the 5th of every month. And so if you contacted me on the 15th and said, I don't want to redo it next month, I'd say, all right, no problem. You paid for me till the 4th, so we're good. Let me know what you need until then. We have had at least one patient so far who said, hey, I want to pay for a year in advance. That's easier for me. And I said, I can figure out a way to make that work with our system. So you're welcome to, but we don't require it. Some offices do require a bit more of a upfront sort of investment. It just depends on how they set it up because each DPC office is different.
Independent.
Mhm.
Great, thank you.
Yeah,
Thank you.
good questions.
Okay, I got a couple questions too, and I apologize. Just as Kristen asked the question, I took a phone call in my office. Where
Okay.
are you located?
22nd and Meridian, just south of that, like, I don't know, 25 feet south of that.
Okay, so where does one go for these tests? Let's say you needed a urinalysis for a UTI or something like that. Where do we go for that?
So if you need something like a urine test that I can actually collect the sample for by just giving you a cup in the office, then you don't go anywhere. For that, I will just give you the urine cup because I have the testing equipment from the lab company. Same thing with a throat swab. If you need something that I can collect here, a pap smear, a urine test, certain small skin biopsies, things like that, you don't go anywhere. If you need blood drawn, you could ask me or Dr. Holliday to draw it. I don't think I'd recommend that. It's not in our skill set of something we do all the time. And so you probably won't have much fun. Big old Bruce. But our patients for that, if they want to go to the facility that we've contracted with as like the direct billing for the discounted fees, then you would go to one of the LabCorp facilities in town. I know that they have one on the north side. They have one near Castleton.
And
And
there's
there's
on the
a
west side.
west side. I know. And there's, I think one on the south side. I'd have to
Uh-huh.
double check. But they have a whole list of places around the city. And it's a $3 fee for them to draw your blood for our
And
patients.
it's so easy. We just send the lab order over
Yep.
and you just know when their hours of operation are.
Yep.
And you just show up.
Yep.
And
Simple.
Yeah.
If you want to use your insurance, if you have insurance and you want to get billed through your insurance for the lab, for the blood work, then I could send it to any lab you want. I have had patients who've gone to an IU health facility. We've had patients go to LabCorp anyways. That is really up to you. But we can find places that will make it convenient for you.
Okay, I'm sorry to be so thick. That was totally confusing to me. So you
Okay.
said, how do you get me the cup? I mean, do I
Oh,
come to you at
I
your
have it in the office. Here's how I get you the cup. She can answer your next question
Yeah.
and I'll show you how long it takes me
Yeah.
to get this.
yeah, she's going to go get a cup.
So I come to your office?
Yeah.
Okay, that was the question. Okay.
Yeah.
I'm ready.
All right. And then
I've
so
got your cup. It's right here.
okay,
So
so
yeah.
I come to you at 22nd Meridian.
Unless you, honestly, if you told me, nope, it's not convenient for me to come to your office today, but I live down the street from that LabCorp facility, I would go, okay, do you want me to send your urine test order to them? And you could just show up at their office. It doesn't matter to me. We can do it either way.
Okay, so I have a friend who she's not yet of age where she can go on Medicare. I think she's 62, 63, and I think you have to be 65.
That's correct.
And she has rheumatoid arthritis.
Mm-hmm.
So she is paying a bunch of money per month for whatever healthcare she's got. And it has been pure hell for her to try to get the Rumeladin or whatever that,
Whatever her like biologic medicine is.
whatever it was an infusion, and they won't give it to her. You have to try this drug first and it has to fail. Then you have to try this drug and it has to fail. Plus out of pocket, it's like crazy high. So what would you do with a patient similar to my friend Grace?
Yeah. So it would depend in that if there was a medicine that she wanted that she could just pay for, then we could try to find the cheapest place for her to go and just get it. But if she wanted to use her insurance, again, you have to just follow the rules of insurance. And unfortunately, there's no amount of common sense that we can document on a piece of paper and show them to say that she needs to be on a particular medicine. So she would still have to do the try this medicine and then fail it, and then try this medicine and then fail it for a disease process that is out of control. That would be a time that, just depending on what it is, we might send someone to see a specialist. For rheumatoid arthritis. It would be preferred that she see someone who has specific training in that. But what we would do is, it could be that she doesn't have to see that specialist as often. could see them more periodically and then see us fairly regularly.
Especially when it's controlled.
Yeah.
care.
When it's
Yeah.
controlled, like it could be that they don't
want
see the
them-
specialist anymore,
Yeah.
and we can just talk to them on the phone and give
Yeah.
them updates.
Just
But
depends.
we could just look at her medication situation and just see the cheapest way for her to get medicines.
Mhm.
So again, that's like a coordination of care and also helping make medicines more affordable.
We have found that, at least talking to at least one patient who has required certain infusions, I can't say that I haven't looked up all infusion medicines, but that person's particular medication for an arthritis type condition, the medicine itself was not expensive. It turned out it was the infusion center. They charge like tens of thousands of dollars to infuse that medicine. So far, we have not done any infusions in our office. I will not say never, but that is something that we would have to assess on a case by case basis of what are the bad things that could happen and is it safe for us to do. So far, we have not found any places that are good options for infusions that patients could just do cash pay outside of the system. But that is a problem that DPC doctors around the country, we have all been talking about. And so if there's a way to make an innovative solution that would allow for this to be handled in a reasonable way, I can guarantee you that those are the types of doctors who are going to come up with it. They're all brainstorming on it and trying. So hopefully there will become things that are a more reasonable solution. We don't have those answers yet, but we're trying.
Thank you for your answers. I know we're about out of time, so I'll stop. Thank you.
Yeah, thank you.
Sure.
Those were very good questions.
Very good questions.
Mhm.
Yeah.
Yeah.
Yeah. If somebody is already on Medicare, what would be the benefit of joining your service? I'm asking for a friend.
That's a really good question. So my parents are on Medicare, and I forced them to both sign up for a DPC practice. Now I couldn't take it from them if like I tried to pry it from their cold dead grip. They love it, but I was like, nope, you're doing this. And they were like, okay. And I was like, you know how you keep complaining about how your doctors don't do this anymore and they don't do that anymore and they don't spend any time with you. And you're getting a little like, you want more time to explain things and you get a little bit anxious when someone rushes you. You're doing this. And I took them to their appointments. I still do. It's been amazing. So their doctor has time for them. Even during COVID, I'm allowed to come to visits because all of the stupid rules about letting enough people in the room. I mean, like, whatever, they see me anyways. I should be allowed in the exam room. We don't wait in the waiting room. They get us right in. They work around their schedule. When my dad the other day forgot his appointment because his tech failed him and he can't iPhone. His doctor, I called them and was like, I'm so sorry, they're not here yet. And the doctor's office was like, well, we had a cancellation. Can they just like show up in the next 15 minutes? And they said, okay. So my dad got in the car, went to his visit anyways, was totally unrushed. The doctor took the time to call me on the phone so that I was in the background answering things. When my mother fell a couple of months ago, she fell. They asked me what we should do for this gash in her forehead. And I said, well, if she's conscious and making sense, you should call her doctor's office. They got them in within 2 hours. They made sure instead of having to pay like their doctor's office does charge a small fee for urgent visits after hours. Honestly, it was very fair and still a savings over what we would have done at the ER that night. If I'd had to take her to the urgent care or ER, I wouldn't have gotten to go in with her. She would have just been stitched up and packaged up and sent on her way, which would have been fine. But her doctor saw her personally, pulled in her colleague who was a little bit better at stitching facial things than she was and said, I want him to do this because he has really good technique. So she's not going to get a bad scar. By the way, let's figure out why you had this fall, adjusted her blood pressure medicine so she wouldn't fall again, made a plan for a couple of other things, and then followed her up 2 days later personally and didn't charge her extra for that. So for me, I've been sitting in on these visits and I've gone from my parents complaining that nothing ever gets handled right and me saying, what did that doctor do? I know they're a good doctor, but what? To I'm thrilled. She has an internist who's like on it and takes care of the whole person. And in their case, I don't know that it saved them money, but it is a small price to pay for their peace of mind and my knowing they've got an actual doctor on the case. And that doctor communicates with me as my mom's memory is getting worse. And it has been a godsend. So it really depends on the person. Some of them may save money with it, but a lot of times as you get older, you have a lot more medical complexities pop up and you don't necessarily get faster at explaining them. And so for me, as the child of parents on Medicare, and I know my dad and mom would say the same thing, it has changed everything. We love it.
Awesome. Does anyone have any other questions for Doctors Holliday and Moore-Ostby?
And I should say that we do take patients with Medicare now.
Yes.
We were not allowed to. The government makes you explicitly opt out as a doctor for 2 years from the Medicare system. And so at first we did not do that because we had to make sure we could make money on other side jobs that needed Medicare billing options. But Dr. Holliday is now opted out. So we can take patients who are Medicare age if that comes up.
Mm-hmm.
Awesome. Well, let's give the doctors a hand for their presentation today.
Thank you
you
for
so
having
much.
us.
Yeah.
We love the chance to share about
Yeah,
this model.
for sure. Mm-hmm.
Excellent. Well, we have run a couple of minutes over here, so I'm going to make a couple of really brief announcements, and then we'll get everyone off to the rest of their Monday afternoon. This Thursday, which is the 25th at 11 o'clock a.m., we are doing a webinar called Cool Things You Can Do on LinkedIn. We are doing,
love this.
we're going to talk about some of the things that have happened over the last year that you can do to promote yourself and promote your business online. So that's 11 o'clock this Thursday. And then Friday the 26th at 4 o'clock p.m. Is our next Fourth Friday meetup at Books and Brew, 3808 Shelby Street. We'll be there 4 to 6, plenty of space for everyone to distance and enjoy a beverage and something to eat at the end of the work week to decompress. So unless there are any last minute comments, questions, concerns, or anyone pledging to live a life without technology after this, we'll have it. We'll get everyone back to their week. So have a happy, a safe and productive week. We'll see you next time.
Thank you so much.
Thank you, guys.